We know that patients often will have to interrupt their dual antiplatelet therapy. Sometimes it's for perfectly reasonable planned cardiac procedures. Sometimes it doesn't seem reasonable at all. The patient just does it on their own and they go off their dual antiplatelet therapy, often without even telling their doctor. Early discontinuation of DAPT, of course, is associated with the greatest risk for stent thrombosis following PCI, and yet published guideline data on just what to do in this case is kind of limited. So what we have is results from the Resolute pooled DAPT study in patients who interrupt their regimen after 1 month and for at least 3 days. And I'm with Dr. David Kandzari, Chief Scientific Officer, Piedmont Heart Institute, Atlanta, Georgia. What were the reasons for DAPT? That was one of the more interesting parts of this presentation. What were the reasons that you found people were stopping their dual antiplatelet therapy?
Let me just give you a little background to the analysis as well. From 8 clinical trials involving the Resolute stent, we identified over 7,000 patients, actually over 7,100 patients, who, in the context of this trial, we had very accurate data regarding their antiplatelet therapy utilization through 1 year of follow-up. And among these patients, a very sizable number, to your earlier comments, 17%, which represented 1,244 patients, had stopped either one or both agents of dual antiplatelet therapy within the first index year of revascularization. What's even more striking is that 15% of those people either elected to or had to stop therapy within the first month of receiving the Resolute drug-eluting stent. And our intent was to further characterize these outcomes, not simply looking at rates of stent thrombosis, of cardiovascular death, of myocardial infarction among those patients, and compare them to patients who continued out through their dual antiplatelet therapy for the entire 12 months. But in addition, more recent data has also suggested that duration off antiplatelet therapy for at least 3 days might be required pharmacodynamically to recover platelet function. And therefore, we selected intentionally a duration of interruption for at least 3 days to more closely mirror what we might consider a meaningful duration of interruption and pose a potential risk for thrombotic events. So with that background, we also characterized interruption by 2 means. Temporary interruption, meaning you'd been off of it for 3 days, but then at one point a patient resumed therapy. Conversely, we also examined permanent discontinuation as well. And to begin with, the type and reasons for interruption depended on the type of interruption. So temporary interruption was, to your point, most commonly related to either an unplanned procedure such as non-cardiac surgery. This by far weighed as the most common reason. And it was soon thereafter followed by patient-related factors such as a clinical event, bleeding namely, or perhaps less commonly an allergy to antiplatelet therapy. And third, followed by simple patient non-adherence or non-compliance. Those were again the reasons for temporary interruption, but in contrast, permanent discontinuation, which represented the majority of patients, and I should note that the majority of patients permanently discontinued antiplatelet therapy after 6 months, and that's consistent with some of the European Society guidelines.
Not in the U.S.
But not in the United States, that's
exactly.
right, and it highlights the lack of evidence and more consensus opinion here.
Exactly.
But for patients who permanently discontinued antiplatelet therapy, the greatest reason for that was simply fulfilling their prescription. And that was thereafter followed by the need for unplanned procedures, like, once again, non-cardiac surgery. But in those instances, for reasons not clear, patients simply did not resume therapy.
Now, there's another trial called DAPT that is going to be coming out towards the end of the year, I believe. We've talked about that. And so I think we may have some better answers soon in terms of which is better, the European approach or ours. In the interim, what can we learn from what you've studied?
Well, two particularly important issues that raise. Number one, the DAPT trial, which is, as you mentioned, a very large global 21,000 patient randomized trial dedicated only towards examining 2 different durations of dual antiplatelet therapy, interestingly is examining 12 months versus approximately 30 months. So it's really not going to address the clinical unmet need for patients with the need for abbreviated discontinuation or abbreviated durations less than 12 months. There are, however, and have been a number of studies comparing 6 versus 12 months, 3 versus 12 months as well. DAPT will be a very important trial, but in some ways it's past its time where we're looking now for more abbreviated durations. In terms of what this study provides for us is that certainly it reminds us that these patient groups, temporary discontinuation, permanent discontinuation, completing a 1-year course. They're very different patient populations, expectedly for many different reasons. But in the common need, as we've identified that patients must interrupt antiplatelet therapy, again, temporarily or permanently, these data provide information regarding the risk of cardiovascular death, of stent thrombosis, and of myocardial infarction when it must occur. And in particular, this study highlighted the fact that when antiplatelet therapy interruption of any sort in the first month occurs, it is associated with a high risk of cardiovascular death, of myocardial infarction, and stent thrombosis. But interestingly, after the first 1 month and through 12 months of follow-up, interruption was associated with a low rate of events that was comparable, if not lower, than patients who continued on dual antiplatelet therapy throughout the entire year.
Well, thank you very much, because I think this is an important topic and one that we're hopefully going to find out a lot more about in the next year or two, I would say.
To be sure. Thank you.
And in the March CardioSource World News, our cover story is on this very issue of dual antiplatelet therapy, so please check that out too. I'm Executive Editor Rick McGuire.